4 ways to get a diagnosis of lipedema, and the last one, you might actually be able to do that at home by yourself. Firstly, understanding the symptoms is the key bit. If you're finding that you're not losing any weight despite having a calorie restrictive diet and exercising, and you're getting swelling elsewhere but your hand and your feet are not being affected, then you might want to think of the diagnosis of lipedema, because there are some characteristic hallmark signs and symptoms. So you want to look for symmetrical fatty tissue, so fat buildup in both sides, and it's symmetrical on the upper and the lower limbs, and the hands and the feet are spared. So typically that's not where you're getting the fatty deposits, and it's known as the cuff phenomenon or the elastic band. So the hands are slim and the feet are slim. Also, you want to look for pain and tenderness. So in the affective areas, the person will feel that they're getting a lot of tenderness, particularly if you apply pressure to that. So pressure to the legs, and you're finding that you're tender, and also you're finding that you're getting a feeling of heaviness and tension in the affected limbs. There's a tendency to have cold skin, which worsens over the course of the day, and easy bruising. So without doing anything, you're finding in your lower limbs or your upper limbs, you're finding that you're just easily getting these marks or bruises known as hematomas on the affective areas. Lipedema is a progressive condition. It's a whole body, lifelong inflammatory condition, and it mainly affects about 10% of the female population. Now, male sufferers have also been described as getting this, but that's actually just only a few case reports that we've noted. And it's the initial signs of lipedema which we need to look out for, and they usually arise in the phases of hormonal changes. So we think it's because of the estrogen hormone impacting the adipose tissue. So where do you get that most? Well, you'll get it in puberty, pregnancy, menopause. So these hallmark signs of disproportionate distribution of body of fat on the arms and legs while the trunk remains similar is really classical, and it's worth looking it up. Not all people get all the symptoms. So some of them just get it on the arms, and so I've even had a patient who had it in their breast, but it's well worth looking out for this sort of pattern distribution. Number 2, you might need to do your own research and be aware of other related conditions such as lymphedema, obesity, and venous insufficiency, which are also related conditions and often diagnosed instead of lipedema. Number 3, look around in your family. We think that there could be a genetic predisposition. As much as 60% of patients have an affected first-degree relative, so that's mum, sister, or daughter. And number 4, ask to see your doctor and come in with your symptom history. Share your ideas and concerns and expectations, and say that it might be that you need a referral to a specialist clinic. Sometimes that could be the lymphedema clinic, because depending on your local CCB, it is a bit of a postcode lottery. It could be that that's where other things have to be ruled out to make the diagnosis. But your GP can do an examination, so look at the physical symptoms. Also do baseline bloods to rule out any liver or kidney dysfunction, hypothyroidism, so even possibly subclinical hypothyroidism, because that overlaps as well. You might want to do lipid profile, so your cholesterol and insulin resistance can also be ruled out by blood tests as well. And also a doctor should be taking your menstrual history and see what hormonal changes could have happened. Could it be the onset of puberty or pregnancy triggers or even the menopause? Now, if that's the case, which isn't always the case, that it's going to be a hormonal thing, then the doctor can do a stemmer sign test, which is about 92% sensitive for lymphedema. But a negative stemmer test is one of the criterion for lipedema diagnosis. So just a reminder, if you don't know, a negative sign, which is normal, is when you can fold the skin at the base of the second toe. So if you gently pinch the skin between the second toe, and that can be pinched up and lifted, that's a negative sign. A positive stemmer sign, so you have lymphedema, then the fold of the skin at the base of the second toe cannot be pinched and lifted up. So that's just one of the signs that could be useful. And finally, I just need to say this, it can sometimes take a long time to get the correct diagnosis. Be your own detective. You are not being the problem by asking for a second, third, or fourth opinion. You are just simply advocating for your health. Because I see it, there are long-term complications of lipedema, including chronic pain, mobility issues, joint pains, and the development of lymphedema. There's also psychological impact and emotional challenges such as depression, anxiety, and eating disorders and body image issues. Particularly if you think about it, you're going through your pubescent changes or even pregnancy, and you are just finding that there is this fat that's accumulating, and it's not obesity, and it's not because you are fat. And so therefore it's so common that I see people who develop lots of complications due to this chronic nature of this condition, which is often overlooked. As always, if there's any questions, please do leave them down below.